When do we diagnose perio? What are we going to do to treat that?
How does the hygienist's identity change when they're treated as a prevention leader?
You have to be in charge of your fees. There is almost no way that you can stay in network with insurance and also feel like you're doing your best for your patient.
So Colby, how do we make the hygiene department profitable within a practice without making it feel salesy?
Which no one wants to bring up, but it is really important to know that we're providing care based off of what the patient actually needs and not just what their insurance will cover for that day.
A lot of dental offices have hygiene departments that are busy, booked, but still underperforming. Not because the hygienists are bad, but because the system is built like a Prophy mill instead of a prevention department. Now, Colby, when I say the phrase Prophy mill, what does that really mean to hygienists?
The first thing that comes to mind is that our patients are not getting our best and that we're going to feel like we're falling short every single day because there's care left on the table.
When we built our office, we did not want hygiene to just be a revolving door. We wanted hygiene to be where patients were educated, periodontal disease was diagnosed, inflammation was treated, sleep and airway concerns were noted, and long-term trust was built. So Colby, what does a prevention-led hygiene department actually look like in real time?
In real time, hygienists are pointing out airway concerns to their patients. They're really clear on their perio diagnosis. When do we diagnose perio? What are we going to do to treat that? But we're also bringing up restorative concerns before things start to break down and cause pain.
How does the hygienist's identity change when they're treated as a prevention leader?
Hygienists are excited to go to work. They feel empowered. They know that their case acceptance is going up. Obviously, revenue goes up from that, but we just feel like we're ready to work because we know our patients and our doctors are there to respect us.
So Colby, how do we make the hygiene department profitable within a practice without making it feel salesy?
You have to be in charge of your fees. There is almost no way that you can stay in network with insurance and also feel like you're doing your best for your patient and making enough revenue, which no one wants to bring up, but it is really important to know that we're providing care based off of what the patient actually needs and not just what their insurance will cover for that day.
Speaking my language, I'm always talking about this because it starts to mess with your mind when you let this kind of middleman dabble in your diagnosis and your treatment recommendations. Whereas there's an enormous amount of trust and relationship when you can just be really honest. Hey, this is what you need. I'm going to recommend this based on what I feel is best, as opposed to like, well, let's let this third-party person kind of come in and dabble in our thoughts a bit. So we started seeing hygiene differently when we stopped thinking about the appointment and started thinking about the patient journey. Hygiene became a place where we could identify disease earlier, educate better, and just create more comprehensive care for our patients. If you're building a startup practice or trying to rebuild the practice that you're currently in, don't just bolt hygiene on as an afterthought. Build it as one of the main engines of your practice. So Colby, what would you tell a hygienist who wants to become more of a provider in their practice and less of a Prophy mill?
Start with showing your patients what you're seeing in their mouth. Show them photos, show them their perio chart. Explain why their oral health is fully connected to their total body health, and be specific. Tell them what they need to be doing at home and tell them how to fix it.
Whether you're a hygienist, assistant, admin staff, or a doctor within a practice, if you appreciate this video and you know that your hygiene department is capable of even greater heights within your business, please like and subscribe. Send this to someone you think would benefit from it. We're putting out content like this every single week, and we're passionate about helping practices grow to their utmost potential. Thanks for tuning in. See you next time.